We are greatly honored by the presence of our national leaders and the distinguished guests who have taken time out of their busy schedule to witness the milestone that will come from. Your presence reminds us that health care, and particularly the fight against kidney disease, is a matter of national importance. When we began this journey, we came with hope, curiosity, and a strong desire to serve our patients better. Along the way, we faced challenges, long hours of learning, complex clinical skills that were being impacted on us, the emotional weight of caring for a patient battling with a kidney failure. Yet through determination, teamwork, and through the guidance from our dedicated trainers, we've reached this proud moment today. Dialysis nursing is more than a profession. It's a calling. Every dialysis session represents another chance at life for a patient who depends on our knowledge, skills, our compassionate care, and our vigilance. As dialysis nurses, we are not only caregivers, but also educators, advocates for patients, and source of hope for the patients and their families. Today's graduation, therefore, represents more than completion of a course. It represents a renewed commitment to saving lives, improving kidney health services in our motherland, Uganda. We extend our sincere appreciation to our trainers, mentors who patiently guided us, shared their expertise, and inspired us throughout the course to grow professionally. Your dedication has shaped us into more competent and professional nurses. We also extend or thank our families who loved us, who stood with us during the time when we were carrying out this course. Your encouragement, sacrifices, and belief in us made us possible to persevere throughout this course. To our leaders and partners in the health sector present today, we humbly pledge that the knowledge and the skills we've gained from this is going to be used to serve our communities with integrity, professionalism, and compassion. We hope that together we can continue strengthening dialysis services so that the patients with kidney disease across our nation can access the care they deserve. To my fellow graduates, today we celebrate our achievement. But tomorrow our work continues. Let us carry forward the spirit of excellency, the teamwork, the humanity that has brought us this far. Let us always remember that behind every machine is a human life depending on our knowledge. And in my closing, let this graduation not only mark at the end of our training, but also the beginning of our greater mission to serve, to heal, and to bring hope to every patient entrusted to our care. Remember, behind every dialysis machine is a life. It's not just a patient, but a human life, a family, and a hope for tomorrow. Thank you all for the support, your presence, and your commitment in improving health care in our motherland, for God and my country.
Thank you so much. At this juncture, allow me to invite our course leader, Professor in the making, Dr. Peace Bagasha.
Thank you so much, Sally, and congratulations to the graduates. It's a true honor to be able to enjoy this day with you. I am so privileged that we get to celebrate, and congratulations for completing this course. I would like to invite our dear guest of honor, Dr. Ibrahim. Dr. Kazi-Njema, our senior consultant and founding member of the Uganda Kidney Foundation. Dr. Rose Muhindo. Dr. Rose Muhindo has been a pioneer for all of us. We call her number 3 in the Kidney Foundation. And then we shall read our graduates. Please come, you pick your certificate, and you can take a picture with our guest of honor. So number 1 is Chikomanga Edward. John, Edgar Tarema, Lilian Nabagala, Namuga Macharis, Alobo, Jennifer Wang,
balindira awo naye nkubendera aho nahali kibwaho ezo sente yombe ono wanakwenda ati awo omugaga wanangambira mukwate kakaizi muno mugaikulumu alina iPhone.
That's it, Simon.
Sanaginyesa omugaga ominga omugaga wange ampangisize takaizi tera ogumegasi nyamukwata omugaga wange
Immaculate Kazi-Njema. Bamboo donation.
Mbwambu okuba era onabeera graduate
Atubo William Ojo.
sente zinako
Kimani Macharia Anthony. Kabanda Leonard. Nachitende Esther Alexandra. Ndagire Edith. Lugwama Edwin. Kazahura Justice. Loanga Jonathan. Kabuma John Peter. Wambete Fiona. Monica Grace. Salema James. Reste Nalize. Nabakoza Zainab. Joyce Meme. Chomjishaho.
kyomugisha
Namaweje Teddy.
takwamukota muleka waliteeki
Kayemba Yahaya. Suruga Jonathan.
tinfunakuwambe funa ebitulafuda tuta
Huge congratulations. Please give them a round of applause. Congratulations to all of you. I hope that you will be inspired to wear this one as well.
Thank you so much, Dr. Peace. We shall cut the cake later after the program. Back to the chair.
To resume our schedule, we'll have our next speaker. Our next speaker, Mr. Mbarara Joseph, is a public health advocacy expert in UK Health. He also has run an organization called Health Life Promotion Africa. He's been instrumental in advocacy along our journey. He's going to give us lessons in 10 minutes.
Good afternoon, everyone. Wow, thank you for being around. Thanks for being part of UKF. I'm sharing the journey of Uganda Kidney Foundation since it was founded in 2011. Joseph Mukasa, a public health advocacy expert, and the founder of Health Life Promotion Africa, an NGO which acts as the advocacy arm for Uganda Kidney Foundation, Health Life Promotion Enterprises. I'm also behind supporting hospitals with quality diagnosis. So I love prevention. So diagnosis is good. It helps a lot in fighting. It helps a lot in clinical management, and also behind on-site care Uganda Limited, which is helping doctors to reach out to the patients in their comfort. So, I discovered Ugandans we have a challenge of laziness, we don't want to strain, so convenience is one of the key things we're looking out to, and this is the initiative I've come out with. So nurses, this is a good cake for you. Anytime we'll be reached out to support patients in their comfort. And it will be something. So anyone who's ready to invest in private initiative and you have the money, kindly come and we keep going, push this initiative. So UKF was formed in 2011 with 3 nephrologists and a team of nurses, and it helped from Rashos, which is under Yale and Makerere University collaboration, supported by Pharma, other private donations and private partners, where Health Life Promotion Africa is part of. It's made up of health workers, psychologists, policymakers, patients, well-wishers, and many others, with 3 arms: Urea, UKEPSO, Health Life Promotion Africa. Objectives is, one of them is patient education about kidney health. We realize information should be disseminated to the patients so that the fight against kidney disease is ended. And also, we look forward to see that health workers are also given the right information through health worker education in less CMEs. We have to continue screening, which is done mostly in World Kidney Day celebration, but in my arm, Uganda, Health Life Promotion Africa, I'm doing that. So meaning, we bring a lot in regards to supporting patients. The lady who lost your father, we are so sorry as UKF, but what I can assure you, we are working, we are doing our best to see that we bring health to the people as much as we can, but we are doing in our means. Maybe pray that we can get the power to make policies. That's the prayer. In case I myself can be part of the policymakers, I assure you maybe better results shall be achieved. We also, we gather evidence-based information regarding kidney disease in Uganda. that's renal registry, and also endless public awareness. And in this case, we've got support from the media companies which are willing to call our health workers in the name so that they can reach out to the public. One of the target groups is which we have as UKF is government. We have Minister of Health, Minister of Education to be part. We want it to be part of us, and right now we're doing our best to see that we push the agenda together. General public, all healthcare practitioners, professional groups specifically formed for purpose of renal care, kidney disease patients, foreign institutions, and in this case we have ISN, AFRAN, many others, even private organizations. Achievements, we've taken a big step in impacting the public, and in this case, allow me to thank the whole UKF, but first I thank Professor Karisula for this initiative, UKF doctors, nephrologists, the whole team of UKF, government support. Allow me to go to, for the respect of time, let me share the achievements first. Dialysis centers have been put in place, government support for training, transplant, bill has been drafted, health insurance which is yet to be also signed, local and international partnerships, media partners, and also nephrologists have increased from 3 to 15. We have expectations of having advanced renal care in Uganda and Sub-Saharan Africa, accessible health services, universal coverage, interpersonal engagements, government leadership, collaboration, and the synchronized patient support from different professionals, cardiologists and nephrologists, and many others working together for the same cause. Also, we want to reach the whole recommendation of 1 doctor to 300 patients. But right now, it's in Uganda, we still have 1 to 15 million. 1 to 3.2, just because we have 15 million or 16 million 16 nephrologists, I'm sorry. Yeah, so we are doing our best. We have a recommendation to make, in this case we have a recommendation to have government commitment and involvement in renal care. And also, we want to have widely available basic screening services, finances to support our cause of promoting kidney health. We want to see that our workers are motivated. This is what I've been doing, and also UKF has been pushing for it. We want to see that specialized drugs are made available at an affordable fee, and then more dialysis facilities in every district or every constituency. That's our goal, including having kidney transplantation done at a very affordable fee in Uganda. I want to say thank you. Urea is part of the UKF, and I'm not going to go deeper into it, but thank you so much. Yeah, have a good afternoon.
Thank you, Mukasa, for giving us your talk. Allow me invite our next presenter. Her bio is really long, but when I call her Professor Bagasha Peace, which is all in this booklet, I think we shall follow. Thank you. Dr. Bagasha, please.
Good afternoon, everybody. I hope you're all well. This is a difficult task, being the afternoon after lunch presenter. Please stand up maybe and stretch your hands so that I know that we are all awake. Stand up, stand up. Okay, have you finished stretching? Stretch, stretch, stretch your hands, stretch your legs, stretch your abdomen, stretch your in front parts and behind parts. Okay, you may sit down. So my job here is to talk about, this segment is about Uganda Kidney Foundation and the work that Uganda Kidney Foundation is doing. As you've heard, Uganda Kidney Foundation is a foundation for everybody who is involved in kidney work, so including nurses, doctors, nutritionists, patients, advocates. So trying to advocate and make sure that the work that we do to make our patients better is heard at every level of every country all over the world. And as you've heard from our very own Professor Kalesula, if you don't talk about what you do, he said it's like smiling to a beautiful girl from under the blankets. Nobody sees. So it's really important. And my section is to talk about kidney transplants, the work that we do as Uganda Kidney Foundation, Ministry of Health, Mulago Hospital, to make sure that we make life better for patients who have kidney disease. So I'd like to begin with these quotes of our patients, saying that expressing how much suffering they go through when they have kidney disease. So this is from the patient's point of view, but then imagine from the doctor's point of view how you feel looking after a patient who is feeling like this. It's really depressing from the doctor's point of view. So just think about that and what can we do to make life easier for our patients in terms of caring for them. So in terms of caring for them, the resources are very limited as doctors. We don't have that much to go with in terms of how much we can provide. We already know that our patients come very late. We already know that we have very few dialysis centers in the country, and we already know that because they come very late, the outcomes are very dismal. So the outcomes are very dismal because we know that when you compare patients who are on dialysis compared to patients who are not on dialysis and receiving palliative care, the survival is almost the same. Imagine how dismal that is. And imagine the fact that when you have a patient who's on dialysis, in our national referral hospitals, the survival is only about 8 months. Isn't that really bad? It's terrible, it's very terrible. And that's why if we improve the resources that we have by, for example, training the nurses, it means that you have better care in the dialysis units, and therefore you have patients who have better outcomes compared to those who don't have dialysis when they invest their money in dialysis. We have already heard that dialysis is like the iceberg. Patients come in when they have advanced disease. We know that 1 in 10 patients. So if you count each of you, 1, 2, 3, 4, 5, 6, 1, 2, 3, 4, 5, 6. Number 10, all the number 10s of you are likely to have kidney failure. So think about that as you go home. Make sure you have tested your creatinine, your urine output, your blood pressure. Let me pose a question. How many of you know how many times you passed urine today? Today, just today. Put up your hands. So now imagine you're asking a patient who has other problems with their heads, how many times do you pass urine in a day? How much urine do you pass? Don't you see that that's a very difficult question? And for that reason, kidney failure is a silent killer because nobody knows. Nobody knows until you think about it, until you ask about it. Therefore, you should have that mentality in your head. Every time you see a patient, ask them about how much urine they make ask them about what is their blood pressure so that the patients are just as aware as the healthcare providers. So, when patients have kidney failure, the alternative is for us to make their lives better as healthcare workers. And we know that the gold standard, the thing that really makes kidney failure better, is kidney transplant. And kidney transplant is what will give you a good quality of life if you have kidney failure. But remember that kidney transplant is not for everybody. So I'm going to tell you about our kidney transplant program that we are trying to pioneer and to grow and to develop so that every regional referral hospital is able to do kidney transplant surgery. Can I get an amen? Amen. Okay, so what is kidney transplant? Kidney transplant is when somebody donates a kidney to you. That somebody may be alive, and that's the live kidney transplant program, or that somebody may be deceased, and that's the deceased donor program. So the program that we are pioneering in Mulago is the alive kidney transplant program, because the logistics required to do a deceased donor program are way beyond what we can afford as a country. It needs us to have a very good ICU system. It needs us to have jet planes to fly the organ, because the organ only has about 30 minutes of survival before it's not helpful to anybody. It needs us to have a very good emergency system, which are all systems which are getting into place. So my firm belief is that in the next 10 to 20 years, maybe even 5 years if we are lucky, we shall be able to progress to a deceased donor program. But in the meantime, we have a live donor program. And as our live donor program's mantra goes, we want kidney transplant to happen on Ugandans, by Ugandans, in Uganda. That is our mantra. That is what we want. And it's unfortunate you can't see that picture, but that's a picture of kidney transplant surgery happening in Mulago Hospital. You see the surgeon is Ugandan, the second surgeon is Ugandan, the nurse, the scribe nurse is a Ugandan, the patient is a Ugandan, and that's in Mulago Hospital. So our mantra is our dream and our vision, and we hope that we shall keep the candle burning and grow until we are able to reach all the different regional referral hospitals. So like I said, kidney transplant offers the best survival odds as well as the best quality of life for any category of patients with renal failure, as long as the patient is selected properly. This was a New England Journal study which showed without doubt that kidney transplant offers the best survival outcomes for patients. So kidney transplant is you get a kidney from a donor and you implant it onto the iliac vessels of the recipient. The recipient remains with their original kidneys. People always ask what happens to the original kidneys. We don't take them out, they remain there. So you have 3 kidneys, and your donor has 1 kidney. And if that extra kidney fails, you can get a second one, and a third one, and a fourth one, as long as you are able to get the service for you. So what are the benefits? It offers a good quality of life. You have more energy, more time. Imagine you're not tied to a dialysis machine. You're able to travel. You have no dietary restrictions. They tell you these things that you tell patients, you can't eat matoke, you can't eat avocado, all the nice things in life. Now the patient can eat it. So imagine how revolutionary it is for the patients to be able to eat mangoes or to eat bananas, because you said they couldn't eat them when they were on dialysis. So it's really revolutionary, but it comes with risks. One of the biggest risks is infection, because we depress your immune system so that you're not able to recognize the new kidney. And because of that, it means that you're likely to pick up infections. And if you pick up infections, it's likely to be a very bad infection. So there's a risk of infection, there's a risk of bleeding, especially in the first 72 hours surrounding the surgery. You may need to have repeat surgery, you may get problems with blood clots, you may react to the anesthesia drugs, and of course the worst is mortality. So, what does a perfect donor look like in our program? And I need you all to know this because I'm hoping that you refer your patients so that they come and build our program. So the perfect donor is a patient who is your is a non-patient, a very healthy patient who is your identical twin. That's the perfect donor. How many of you here have identical twins? Hands up. So that means if any of you got kidney failure and needed a transplant, you'll not be able to get a perfect donor. Okay? So that means that the next step is your relative, immediate relative. So either your parents, your siblings, or your children. That's the next best because their DNA is somewhat close to yours. And then the person must be completely healthy. So no cardiovascular disease. Right now we're not even taking diabetes. No hypertension, no infections. The person must be absolutely healthy. Okay? So you see how the pool begins to narrow as you begin to select your patient. The eligibility criteria for a patient to come, the patient must have been reviewed by a nephrologist, ideally, and then must be willing to undergo the surgeries. They must be very well motivated. They must have good social support. If they don't have good social support, they won't be able to come for the visits. They won't be able to take their medicines as they should. They must not have any cancers, no infections, no serious medical condition. Our most prevalent medical condition, as you have seen, is cardiovascular disease. So if we do the echo for the patient or for the donor and it's not good, that means that they are not eligible. So we go through that rigorous screening process to make sure that the patient comes out well. And when the patient does come out well, it's a big relief for the patient and for the team. So, so that is all the screening that we go through, and eventually we take the patients to theatre. And the theatre team is quite massive, as you would expect. It has the nephrologist, it has the surgeons, it has the nurse coordinators, the surgeon, nurse, theatre nurse coordinators, social work, transplantologists, anesthesiologists, psychiatrists, a whole works. Okay? And that is why it is very important to be able to support the program and to be able to grow the program. Because all these people don't come together by accident. And the goal at the end of the day is to see urine. To see urine. That is the goal at the end of the day. And that's why I began by asking you how many of you know how many times you pass urine. Because when we do transplant, that is our goal. We want to see urine. And you can imagine when you're in theatre, as soon as you finish anastomosis, the donated kidney, you release the clamps, the first thing you see from the ureter, even before you attach the ureter to the bladder, is urine. And everybody gives a cry of joy because it's such an amazing feat to see the urine coming from the ureter the minute the clamps are released. So that is the goal of the whole process. So overall, we have been able to do 15 surgeries, transplant surgeries. We do them in camps. We've had 5 camps in total right now. Our patients are aged 47 to 16. So our oldest patient so far has been 47 years, and our youngest has been 16 years. We have more males than females, mainly because females we eliminate if you've had previous pregnancies. We'll eliminate you if your donor has had previous pregnancies. And the reason why is because when you have pregnancies, a pregnancy develops antibodies, and those antibodies are likely to attack your new kidney. So females are slightly disadvantaged. Males, on the other hand, because they don't get pregnant, don't have that problem. But in case you've had multiple blood transfusions, then you have that problem. So if you've had multiple blood transfusions, we will screen you to make sure you have no antibodies. Most of our patients have been on dialysis for quite some time. The shorter the time on dialysis, the better the outcomes, because when you're on dialysis for a long time, you get dialysis-related complications such as heart failure, such as volume overload, poorly controlled, so you then begin to become ineligible most of our patients are like I said, not diabetic, most of them hypertensive. We had one, the 16-year-old, she had malaria-related acute kidney injury and had then progressed to dialysis. Most of our donors are brothers. So how many of you don't have any brothers? Hands up if you don't have any brothers. Make sure you don't get kidney failure. Most of our donors, again, are aged between 40 and 20. We have the same regimen in terms of who gets immune suppression. Our outcomes have mainly been good for all of our patients, except the one patient, the one recipient who passed on. But otherwise, 14 very well healthy patients are now off dialysis. So, what have we learned in all of our 5 camps? I'll just go by one. So the first camp, we learned that preparation is key. We were supposed to have 4 surgeries, but we ended up having 1 because we had not prepared properly. So preparation is key. You have to make sure you have everything in line in terms of the healthcare workers, the medications, the surgery, everything has to be in line. So for that first camp, we learned that we have opened ground, we have had our maiden transplant, even though we're not able to have any other, we have had our first maiden transplant. And it was a very exciting period. We even went to meet the president of Uganda. Just from one transplant. The second camp was a whole year later. A whole year later, this is now 2024, November, and it went very well except for one patient who, as soon as we did the connections, did not pass urine. Imagine how panicked we were in the theater. There was no urine. We waited and waited and waited, and there was no urine. So that patient had delayed graft function. We went back and evaluated what was the cause of the delayed graft function. To this day, we have never found out. But fortunately for us, 72 hours later, they started to make drops of urine. So it was 25 mils at first, then 100 mils, then eventually we went all the way to 3 liters in 24 hours, and we jumped for joy. The third camp was perfect. No problems at all. All of our 4 patients did very well. That's when we had our youngest patient, the 16-year-old girl. That's when we had our oldest patient, the 47-year-old boy. Everything was perfect, and we learned what a perfect transplant looks like. The 5th camp was perfect until we got to the 4th patient. The patient was on table, and then we got the morning CBC, and the platelets were low. So we couldn't proceed with the transplant. We had to tell the patient to go back. We brought the second one, the platelets was low, we had to tell the patient to go back. So then we learned that we have to make sure that all the labs are in at least 2 hours before we take the patient to surgery. And we also learned that you have to have at least 2 backups. Because if the day goes, then the people who have been assembled to come have to go back to their duties, and that's the end. And instead of having 4 transplant surgeries like you had planned to have, you end up having 3, and that means 3 patients admitted who don't get what they want. Everyone is unhappy, the program is suffering. So we learned that we have to do labs at least 2 hours before we take the patient to surgery, and therefore now we always take off labs at 5 a.m. so that by 7 we are ready and we know who's going to go. And then the 5th and final transplant, we got a mortality. That is the worst thing that can happen. Despite all the preparations, everything that we had learned, mortality finally came our way. And you always say we can't say we are perfect until we have had bad experiences, and we've been through the bad experiences. And despite this, we were able to pursue, to continue, and have 2 more surgeries. So the program still continues, and we hope that we shall be able to do more Because when you have a mortality, everyone gets scared, everyone gets jittery, but we are able to overcome this and moved on to 2 more surgeries. So, what have we learned? We have learned that we need to improve our protocols, we need to improve our pre-transplant workups, we need to improve our pre-transplant patient reviews and expand them to be able to cover anything else that could possibly come. We have learned to improve our ethics workup, we have learned to improve our consenting process, and most importantly, we have learned to overcome the worst thing that can happen to our program, which is mortality. And finally, the discharge day is usually our best day, when we say bye to all of our very healthy patients and continue to follow them up. And because of that, we're able to overcome this, our patients saying that this is the worst disease, because we give them a better chance at a better life. Thank you.
Thank you for the excellent talk, Dr. Bagasha. We have one more senior session, and I'd like to invite Professor Kalesula, whose office I walked into about 12 years ago. I walked in trembling, and I asked him if I could become his follower. He's walked further, I still can't find him, and he's going to tell us, he's going to give a presentation titled The World Kidney Day Celebration and its Impact on Communities.
Thank you very much, Dan. Yeah, I also went through the same experience. All protocols up. When I walked into Dr. Jigonya and Dr. Sekasam's place, they were very nice, and that's why I'm looking at Dr. today. So I wasn't very mean. But Dan, I was very nice to you. Remember that dialysis unit when the management was not being very nice. So I'm going to be talking about the World Kidney Day and why we are here today, caring for people, protecting the planet. Lucky for you, I only have 11 slides. The other ones were 67, so I'm going to be done in a very short time. So I'm going to explain why the theme was chosen for this year and its relevance to Uganda. Where did the World Kidney Day come from? And then I'll show the links of why people think that the environment, work condition, and kidney disease are related. Then I'll present a few community action points that we can take moving forward as a Uganda and as the Uganda Kidney Foundation. So today we are celebrating 20 years of the World Kidney Day. It was launched in 2006 by the International Society of Nephrology along with the International Federation of Kidney Foundations. These are very big organizations, and they are actually, I think, the biggest in the world of kidney health. Although the American Society of Nephrology always wants, it's nice, but of course it's limited to Americans, so that makes it not worldwide. So we observe this day on every second Thursday of March. I remember one time the World Kidney Day coincided with Women's Day, but by and large we share the month, but the World Kidney Day is the second Thursday of every month. And it has evolved over time to become a global movement where we try to improve awareness about kidney disease across the world. So this is not about us as experts, it's more about the population. So I want you to imagine we say that kidney disease occurs in 10%, but our key focus should also be on those 90% who don't yet have kidney disease. How do we keep them from walking into our doors with complaints of kidney disease. So caring for people and protecting the planet, what's the local relevance of this? So we are increasingly seeing that we are intertwined with the